Hi everyone! So today I'm at Dubai London Clinic and I'm going to be interviewing Specialist Dermatologist Dr. Umesh on the very common topic, what is Botox and what is a filler? Very basic questions but very important ones.
Botox is actually the brand name. The real ingredient is botulinum toxin A, which is produced from a bacteria called bacterium Clostridium botulinum. Filler is a synthetic material which is prepared from various ingredients. Here we will talk about only hyaluronic acid. Hyaluronic acid which is the most widely used filler. Botox relaxes the muscles. So it usually targets the lines which are caused by muscle contraction, which are also called dynamic lines. When we express ourselves, the lines which the expression produces, like it relaxes to you.
Dynamic lines.
Lines. Fillers, they are for static lines. Even without expression, we have the lines. Fillers fill those gaps. Filler also restores the volume loss caused by degenerating aging changes. It can also contour your body, face contours. It can also lift your face. Other than injection procedure side effects like bruises, swelling, pain, which are transitional side effects, which eventually go in a couple of hours, and they are the commonest side effects. But there are some procedure related or the solution related side effects which are very rare in experienced hands. Botox can migrate in some unwanted muscles. Like for example, if we are injecting here in the forehead, it can migrate down in the eyebrow, which can drop your eyebrows.
It can droop your eyebrows.
Yes, it can drop your eyebrows, it can drop your eyelids. That is why I always advise my patients not to lie down or not to bend neck for next 3 hours till Botox gets absorbed in the muscles.
Okay.
So when you lie down or when you move your head too much, there are some danger zones like the lateral eyebrows. This is a danger zone which you should never treat it. Even though if you have lines, you should never treat it because it can give, for sure it will give the side effects. Same way when we put on the angle, there is some areas like you should not be more medial, you should be more lateral.
Okay.
Which will prevent the dropping of your lip angles. So these are the common things which are very practical. If you know the anatomy of face, you can easily avoid it.
You can easily avoid it, okay. But when you say that the drooping could happen injecting an excess quantity of Botox?
No, it can be injected because if your muscles are very thin, muscle cannot absorb full Botox dose. The rest of the Botox is obvious to migrate in the surrounding muscles. So that is why dose depends upon the thickness of muscles, thickness of your skin, and it has to be justified. Fillers are hardly there are any side effects because filler is very safe material. The best part of hyaluronic acid filler is completely reversible. If we put a hyaluronidase, which is a dilute of filler, you can reverse 100% of the filler. That is the best part. There are some.
Sorry to interrupt, because it's hyaluronic acid we produce naturally, correct? So that's why our body doesn't recognize it as a threat. It can absorb it naturally.
Exactly. Hyaluronic acid exactly mimics the natural hyaluronic acid produced by our body. So it is well accepted. In some cases there can be a little bit asymmetry when you put fillers. There can be a little asymmetry. I would stress here that every body is asymmetrical. If you see right side compared to left side, there is always little asymmetry and we should respect that asymmetry. If fillers is not accepted by our body, it can produce granuloma very rarely, but with good brands, good products is very less possibility of. Depends person to person. In most of the studies, they suggest that it should not be that gap between two Botox injections should not be less than 3 months. But if it is two different areas, if you are injecting once in the forehead and after 2 weeks you want to inject in your eyes, that's fine. That is fine. But it should not be injected in the same area with less than 3 months of gap. Fillers, you can inject indefinitely.
When the Botox dissolves, does that have any harmful effects?
No,
on the
it
body?
doesn't. No, it doesn't has any impact. None of the studies have proven any harmful, long-term harmful.
Would you say maybe to have Botox 3 times a year? Can that be, if we're saying an average here?
Average 3 times in a year. You can.
And with filler, if we say there can be an average as soon as you see that
The lines coming back, or you see the volume, it needs your skin needs restoration, you can always do. If you know the basics, you will be able to know Botox better and know when you need Botox. Botox usually blocks the nerves which are supplying your muscles. So it keeps a curtain between muscle and your nerves. So even though there are transmissions from your nerves, your muscle is not able to contract it. So it softens the lines, it freezes the muscles. But your nerves are very smart. They find new track to supply the transmission to the muscles. So you get starting movement again. That your nerve regeneration, new roots from nerve, it depends upon person to person. Many people, when they use muscles a lot during expressions, athletes, teachers, they usually get frowned yes, by athletes, bodybuilders. They use their muscles a lot. So Botox doesn't last. More you use your muscles, less lasting the effect of Botox would be. Your nerves will be very active and they will find their way to. I have seen many patients, they have effect of Botox more than 9 months to 1 year. And I have seen many patients, they have just 3 to 4 months, after that they need Botox again. While fillers, again, it is same hyaluronic acid as our body produces. It's exactly the same. So body uses as hyaluronic acid as it uses naturally. If you're a smoker, if you're exposed to a lot of heat, your hyaluronic acid will degrade faster, so you get a less lasting effect. No, it is not. That is why if you see theoretically, if you see the mechanism of action, Botox only blocks the nerve supply to the muscles. So none of the reports, none of the studies have proved that your skin loses its elasticity. Yes, we should respect the features, we should respect the ethnicity. The society which you live will accept certain type of features. For the East Asia, or if we put too much Botox, they will get their eye drops, or they can get their eyelid drops because their eyelids are already at the lower level. So it depends upon ethnicity, and we should respect those features. We should do accordingly.
Yes, and especially as you say in Dubai. I mean, we're from all over the world, so
here many times we see the African nationalities coming. The second patient is Asian, and third is European, and fourth is American. So we have to.
So you got to see it.
And the Botox is a foreign protein. Our body can develop antibodies to any foreign proteins. If your body starts recognizing it as a foreign protein, it can start producing antibodies to it. It is it's very rarely found that you really get this resistance. But yes, there is theoretical possible that you can get resistance. Main thing is you should stick to the branded Botox products, not the substandard products which can produce autogenicity very easily. So also the product also makes a lot of difference. If you use the standard one, you get less autogenicity. If you use the substandard one, you can get autogenicity.
Is there any way that can be fixed or reversed?
No.
No?
Once you are done, you are done.
Oh wow!
You are the
So you're
few unlucky ones. To be very honest, there are no proven studies that Botox is safe in breastfeeding. When you do just fillers, it's medical. Yes, it is amazing results, especially in East Asian populations. They get very good results. It's very popular over in that part of the world. It usually makes your nose more straight, it reshapes your nose, and it makes it beautiful. But not all patients are the ideal candidates for medical rhinoplasty. But yes, in many of the cases, we can improve the nose shape. We can also add Botox to it for there are a few muscles on the base of the nose. We can relax those muscles and make your nose slimmer and more straight.
But because it's a temporary effect,
Exactly.
so you would have to keep going back
going
to
back.
redo it the same way you would do it anywhere else in the face.
Exactly.
Correct. And you're saying one of the main indications is to straighten the nose?
Straighten the nose.
Okay.
If you have any dent or indentation, we can correct it. We can make this middle line more straight and more symmetrical.
Oh, interesting. And the results are amazing.
Results are amazing. Amazing.
Good to know for someone that doesn't want to go through the
For
surgery.
surgery, exactly, or they are not fit to undergo surgery, they can always go for
Right.
medical. Nowadays, people are also doing body fillers where you cannot do surgery in your body. That is mostly done by plastic surgeons. For Botox is used in migraines. Migraine is very debilitating condition, having chronic stress or impact your quality of life. It helps a lot. It reduces your frequency of episodes. It makes you symptom free for a pretty long time, maybe 6 months, 9 months or so. It is also, Botox is also used for excessive sweating.
Oh.
People are doing excessive sweating for underarms,
Mm-hmm.
for lower back areas, even for scalp.
Oh, interesting.
So you can use to control your sweating.
Mm-hmm.
It can last somewhere between 6 to 9 months. So it really improves your quality.
Thank you so much, Dr. Umesh, for being with us today and shedding some light on such important and common questions regarding Botox and fillers. I think it was very, very helpful. So it was a pleasure and thank you once again.
Thank you.